Okay. Assalamualaikum warahmatullahi wabarakatuh. Welcome back to IIM webinar 2.0. Our today's topic is regarding the carbon monoxide poisoning. Next. This is our panelists for tonight. We have pharmacy, Hazira Hidayah from Poison Center of SASMED. Dr. Ashika Nadia, ICU specialist of SASMED. We have Assistant Professor Dr. Adibah Hani binti Khalid from IUN. And the last one is me, Dr. Nakshika binti Abdullah from ED Specialist of SASMED. Next. This is carbon monoxide poisoning webinar slot for today. We have 6 slots which are case background, carbon monoxide poisoning, carbon monoxide poisoning management, pharmacy response, do's and don'ts, and actions to do. Next. This is okay. Next, I will present the case background. Next. This is one case straight from our doctor from London. This is the most recent cases of carbon monoxide poisoning. So, for the case summary, this is the case summary. The patient's name is Miss F, age 68. The gender is female, Caucasian. The weight, height, the admission and BSA, we have no data on that, and the BMI also we have no data since we don't have a height and weight. However, in the case, it is stated that this patient is slightly overweight. For the medication history, this patient taking ibuprofen every 8 hours for 2 days without relief and inhaled bronchodilator. Since this patient has asthma that was controlled with regular use of inhaled bronchodilator. The chief complaint is the patient has shortness of breath, dizziness, weakness, and intermittent chest pain. For the family or social history, this patient lives with her son and daughter-in-law. Okay, next. This is a review of system and laboratory data. The blood pressure is 140 over 60, 86 milligram mercury, which is quite normal. Respiratory rate is 28 breath per minute, which is higher than normal range. Pulse rate is 92 beat per minute. Temperature is 98.4 Fahrenheit, and the SpO2 is 95% under the room air, which is normal. For the laboratory data, the only laboratory data is carboxyl hemoglobin, which is quite high, 20, which is quite high, and also ECG. The ECG of this patient is normal. Next. In the case of the carbon monoxide poisoning, the important information that we need is, first, we need the history. The diagnosis of carbon monoxide poisoning is based on the history with elevated carboxyl hemoglobin level. The another data we need is carboxyl hemoglobin. Carboxyl hemoglobin the level is important to determine the exposure of carbon monoxide. However, the level of the carbon monoxide poisoning is not correlate with the level of the carboxyl hemoglobin is not correlate with the degree of poisoning. Another data we need is neurologic examination. Since in the case of poisoning, we cannot rely on the sign and symptom only, so we need to do the neurologic examination. So for the neurologic examination, in the absence of concurrent trauma or burns, physical findings in carbon monoxide poisoning are usually confined to alteration in mental status. Patients that experience carbon monoxide poisoning may manifest symptoms ranging from mild confusion to coma. The last important information is ECG and cardiac biomarker evaluation. Acute myocardial injury is quite common among the carbon monoxide patient. and it is associated with increase of long-term mortality. ECG and cardiac biomarker evaluation usually warranted in patients with ECG evidence and ischemia or a history of cardiac disease. That's all from me, so we can move to the next slide.
Okay, next. Bismillah. Assalamualaikum. My name is Assistant Professor Dr. Adi Bahani from Pharmacology Department of IIUM. Okay, next, this I will present about the background of carbon monoxide poisoning. Okay, next. Okay, what is carbon monoxide? So this is, we can call this carbon monoxide is like the silent killer, because this carbon monoxide has no odor, no color, and no taste. So when there is presence of the carbon monoxide, we can see it and we can smell. So this carbon monoxide is produced from the incomplete burning of material containing carbon such as natural gas, gasoline, kerosene, or propane, coal, or wood. So in our daily activities, there is presence of carbon monoxide. Then if we breathe it for more than 10 ppm, we can produce the symptoms of carbon monoxide poisoning. So from the WHO suggests that level greater than 6 ppm are potentially toxic for a longer period of time. Okay, next. Okay, so how carbon monoxide kills the person, the human? So there are two mechanisms, which are, the first one is carbon monoxide will bind to hemoglobin in the blood with high affinity and forming carbon monoxide hemoglobin. So hemoglobin has 250-fold greater affinity for the carbon monoxide than oxygen. So as we all know that our cells in the body need oxygen to breathe and to respirate. So this carbon monoxide is higher affinity with hemoglobin, which is the transport of the oxygen in our body. So this high affinity will displace the oxygen and will reduce the oxygen carrying capacity. And the oxygen can transport to the organ in our body that need this oxygen for the respiration. Okay, the next one. Okay, the next mechanism is carbon monoxide will inhibit mitochondrial respiration by binding the ferrous scheme A3 in the active site of COX. So this mechanism will shutting down the oxidative phosphorylation, which is similar to nitric oxide and also cyanide. So nitric oxide and cyanide, as we all know, that these two substance is also poison substance. And COX has only threefold preference for carbon monoxide than oxygen. With the COX inhibited, oxidative phosphorylation will slow down and decreasing the ATP production in the tissue and organ in our body, such as brain and heart. So other complexes in the electron transport chain continue to shuttle the electrons and generating superoxide that leading to damage in our cells, which can lead to the damage of our organs such as brain and heart. That's all.
Okay, Assalamualaikum. I am Ashira Nadia, currently intensive care medicine specialist at TASMAC. In this slot, we are going to talk about carbon monoxide poisoning management. In the management of carbon monoxide poisoning, the first thing to do is to remove patient from the source of carbon monoxide. Then the first responders will administer normobaric oxygen therapy. In some cases, where the patient is eligible to receive hyperbaric oxygen therapy, we use hyperbaric oxygen therapy. Next. In normobaric oxygen therapy, we administer high flow 100% oxygen via non-rebreathing reservoir face mask. Giving the patient high flow oxygen can reduce half-life of carboxyhemoglobin to 90 minutes compared to when patient is breathing room air. The half-life of carboxyhemoglobin is 250 to 320 minutes. So oxygen therapy is indicated to all carbon monoxide poison patients regardless of pulse oximetry or arterial pressure of oxygen. So we aim to achieve carboxyhemoglobin level of less than 5%. And before starting normobaric oxygen therapy, first responders will do clinical judgment whether we need to intubate the patient based on level of consciousness and also degree of respiratory stress. In the case of mild poisoning, the duration of normobaric oxygen therapy is 4 hours. We have care teams will frequently evaluate the symptoms. If symptoms resolve, we can discharge the patient after identifying the source of carbon monoxide. However, if symptoms do not resolve, or we found that there is any finding that are consistent with severe finding, we will hospitalize the patient. Okay, next, hyperbaric oxygen therapy. In hyperbaric oxygen therapy, we deliver compressed 100% oxygen. We deliver at high pressure, and the pressure is 2 to 3 times higher than the normal atmospheric pressure. So, this hyperbaric oxygen therapy will increase the amount of oxygen dissolved in blood, induce cerebral vasoconstriction, thus reducing intracranial pressure, cerebral edema, and also reduce the risk of oxidative injury following carbon monoxide poisoning. Okay, the duration of hyperbaric oxygen therapy is normally 90 minutes. However, okay, next, not all patients are recommended to receive hyperbaric oxygen therapy. We use hyperbaric oxygen therapy in the case where patient's carboxyhemoglobin level, patient's hemoglobin level is more than 25%, or in the case where patient has persistent symptoms, persistent symptoms despite normobaric oxygen, as we discussed earlier. In the case where patient has a history of loss of consciousness, or when there are neurological findings such as altered mental status, coma, focal neurological deficits, or seizures, or also in the case where patient is cardiovascular compromised. Okay, patients has cardiovascular disease such as hypotension, ischemia, infarction, or dysrhythmia, or also in the case where patient has severe metabolic acidosis and where patient is a pregnant patient, pregnant lady who has carboxyhemoglobin level beyond 50%, 15%. Okay. To sum up, the first thing to do is to quickly remove the patient from the source of carbon monoxide, and then we administer normobaric oxygen therapy, and in some cases, we give hyperbaric oxygen therapy. That's all for the management of carbon monoxide poisoning.
Okay, Assalamualaikum. I'm Hazira Hidayah, pharmacist at IUM Poison Center. So for this slide, I will explain regarding the pharmacist view and the pharmacist response when we receive any carbon monoxide poisoning call. Okay, so these are the steps or procedure of formulating response. First of all, when we receive a call from the physician, we need to do information gathering first. We need to assess the condition of the patient. As for example, in this case of carbon monoxide poisoning, we need to know the duration of carbon monoxide poisoning so that we can assess the carboxyhemoglobin level of that patient. Thus, this determine the severity of the patient. And then after that, we will refer to any information resources. As for example, we can refer to the MyTalks data, which a website from National Poison Center of USM, whereby from that website we can know the details of the carbon monoxide management and the management and also the treatment. And then after that, prioritizing the information, and we need to consider the urgency and condition of the patient. And after we assess the condition of the patient, we can recommend any either the physician need to further with normobaric or hyperbaric oxygen therapy. And then we need to communicate the information with the reliable references that such as MyTalks data. Okay, so these are the formulary response of pharmacies. And then, so for the additional information that I need to stress here to educate the community as well regarding the carbon monoxide poisoning. So these are the list of do's and don'ts, which are the first, the do's list is are open windows while cooking, maintain your car engine regularly, maintain your full burning appliances, maintain your furnace, and also install exhaust fan in your kitchen or in a closed garage. And for those lists, are don't leave anyone in closed parked vehicle with engine running, don't run a motor vehicle or generator in closed garage, or don't sleep in car with engine running, don't modify your vehicle exhaust, and also don't cook using camping stove in closed camp. So to sum up, don't leave anyone in any enclosed space with carbon monoxide sources. So what are the actions to do when there are symptoms of carbon monoxide poisoning? So I will conclude to 4E, which are the first E is examine. We need to examine which the carbon monoxide sources release. As for example, if we, as for example, we need to turn off burning appliances or furnace in order to prevent the release of the carbon monoxide, and also to open all the windows in order to get the fresh air. And then the next step is escape. Get out of the enclosed space if you are in the enclosed space. And then the third step is to ensure if you have any symptom of carbon monoxide poisoning, please ensure to keep calm and do not panic and limit physical activity, as vigorous physical activity will worsen the condition or the symptom of carbon monoxide poisoning. And lastly, the emergency, if you feel that the condition are worsened, call for medical help. Okay, so these are the 4E that you need to remember. So that's all for this webinar slide. If you have any question, feel free to email to the Poison Center at ium.edu.my. Thank you.